Consensus Conference is one of the streams of action of our CLASP project on policy interventions to reduce obesity. One of the things we've done successfully in the past is hold consensus conferences around potentially controversial or emerging ideas around policy. Our Policy Advisory Committee recommended that we do something around healthy food procurement policies. A lot of these publicly funded institutions are purchasing foods that might actually not necessarily promote health. So the idea is that we could actually potentially improve the population's health if those organizations that were funded by government only used their money to purchase healthy foods.
We had lots of people from all across Canada and even from different parts of the world, and it was very clear that public institutions were strongly advocating that people eat healthy. These same institutions were providing unhealthy food to the people they were serving.
When you work in this area, you feel like you're working in isolation, or you're the only one that's having the same kind of barriers to overcome. And I found it fantastic to hear everyone else has the same kind of issues. Like there's issues with the market's not ready, the products aren't there.
What we saw was some very strong leadership, and I was impressed that they had to have a broad range of knowledge and skills. This is not just about nutrition. It's about how food gets onto your plate and into your mouth.
It is really exciting and encouraging for me to see that I have colleagues and allies across the country who are doing this fantastic work in institutions all over the place, trying to encourage this level of change.
Where are we going to find the kind of leaders that we had in the room today, but enough to bring about change everywhere in the country?
We have a coalition of national health and scientific organizations, and one of the things that we are promoting is healthy food procurement policies by all, the private sector, our own groups, as well as governments.
What it really gave me is additional sensitization of what some of the questions I should be asking that are really relevant to the people that are trying to implement the policies.
Changing to healthy eating is doing something for people as opposed to them, so that it's exciting, and look at this positive thing we're offering you. So I'm hoping to take their resources and either get permission to use them as is or to modify them so that we can have the same kind of messaging.
One of the most important things that I'm going to take home with me from this is the need to communicate about it and to share best practices, pitfalls and triumphs. We can share ideas, we can share what works, we can share suppliers, we can make connections with vendors who are compliant. And I think that there will be much more success and strength if we work more collaboratively as a group.